Good day, everyone. Today I will give you a brief discussion about the Turner syndrome. This study includes a brief history about it, a brief introduction, effects of the disorder, specifically Turner syndrome, some forms of diagnosis, and even available treatments. As you can see below, I've included Mr. Timmy Turner for a little bit of humoral effect. Now, let us start. So, as you can see on the right side photo, that is Mr. Henry H. Turner. He was the one who discovered the Turner syndrome in the year 1938, and he was an endocrinologist. How was Turner's syndrome discovered? So, Dr. Henry Turner described 7 young women aged 15 to 23 who were sexually underdeveloped, short, had folds of skin on the back of their necks, and had malformed elbows. For a brief introduction, Turner syndrome is also known as XO syndrome. So, XO syndrome occurs when a female only has one X chromosome. Another name for Turner syndrome is 45X, which is a chromosomal shorthand. So, Turner syndrome is more frequent among spontaneously aborted fetuses compared to normal newborns. And this results when one normal X chromosome is present in a female cell and the other X chromosome is missing or structurally altered. Now let us move forward with the effects of the disorder. So before birth, large fluid collection on the back of the neck or other abnormal fluid collections is done. Heart abnormalities as well as kidney abnormalities occur. During infancy, swelling in hands or feet and skin webbing on the neck can be seen. Short stature or stop in growth occurs, low set ears, broad chest with widely spaced nipples, high, narrow roof of the mouth, arms that turn outward at the elbows, fingernails and toenails that are narrow and turn upward, cardiac effects, low hairline at the back of the head, receding or small lower jaw, short fingers and toes. For childhood, teens, and adulthood, no growth spurts at expected times in childhood occurs. Adult height significantly is less compared to a normal female member of the family. Failure to begin sexual changes expected during puberty. Sexual development that stalls during teenage years. Early end to menstrual cycles not due to pregnancy. And for most women with Turner syndrome, they have the inability to conceive a child without fertility treatment. As you can see in the photos below, this is what the Turner syndrome does to a human body. Now, there are some genetic alterations of Turner syndrome. This includes monosomy, also known as the complete absence of an X chromosome that generally occurs due to an error in the father's sperm or in the mother's egg. Next, we also have mosaicism. In some cases, an error occurs in cell division during early stages of fetal development. So this results in some cells in the body having 2 complete copies of the X chromosome. Other cells have only 1 copy of the X chromosome. Next, we also have X chromosome abnormalities. Abnormal or missing parts of one of the X chromosomes can occur. We also have the Y chromosome material. In a small percentage of Turner syndrome cases, some cells have 1 copy of the X chromosome, and other cells have 1 copy of the X chromosome and some Y chromosome material. These individuals develop biologically as female, but the presence of Y chromosome material increases the risk of developing a type of cancer called gonadoblastoma. Now let us move forward with the diagnosis. So for the diagnosis, we have karyotype analysis. Karyotype analysis is a confirmatory test for Turner syndrome. We also have complete heart evaluation, maternal serum screening, amniocentesis and chorionic villus sampling, and ultrasound during pregnancy. As you can see in the photos below, these are the forms of diagnosis. On the right side, we can see the ultrasound and collection of amniotic fluid. On the left side, we can see the missing X chromosome, which signifies that there is a Turner syndrome. Now, for the treatment, there is no cure for Turner syndrome, but therapies have been developed that can improve physical development, such as human growth hormone, estrogen therapy, cyclic progestins. Now, human growth hormone are injections of human growth hormones, which can increase height. If treatment starts early enough, these shots can increase the final height of people with Turner syndrome by several inches. For estrogen therapy, often people with Turner syndrome need estrogen, which is a female hormone. This type of hormone replacement therapy can help girls develop breasts and begin menstruation. It can also help their uterus grow to a typical size. Estrogen replacement improves brain development, heart function, liver function, and skeletal health too. For cyclic progestins, these hormones are often added at age 11 or 12 if blood tests note deficiency. Progestins will induce cyclic menstrual periods, and treatment is often started with very low dosages and then gradually increased to stimulate normal puberty. Now, here are my references. Thank you for listening to my brief discussion about Turner syndrome. Hope to see you guys again. Till next time.